right there for me. Welcome to the ASMR OBGYN clinic. It looks like we have you on the schedule for an IUD insertion. All right. And did you already have your IUD consultation? Okay. Did you know which IUD you wanted? The Mirena. Okay. Yep, we do have that one in stock. So I am just going to check you in here. Do you mind giving me your first, last name? Okay. Date of birth? Perfect. Yep, I see you right there. And we'll just need to sign some consent forms before the procedure today. And did you take that sedative that Dr. Smith sent about a week ago? Took about 10 minutes ago. Perfect. And do you have a driver today? Just making sure. We also have some pain reliever meds here. We'll give you a couple tablets before provider comes in. And I think, let me see, did you opt for lidocaine sprays or? Okay, yes, perfect. We'll make sure we have all of that available to you. Any changes to your medical history? Okay, when was the last time you saw your primary care? Lovely. Any new surgeries, or have you been under anesthesia recently? Any change to your smoking or drinking status? Okay. And then let's see here. Any allergies that we should be aware of? And what happens when you have that? Sounds good. Okay, let's see. And when was the first day of your last menstrual period? Okay. So I am going to pull up the IUD insert waiver just to go over a few things to make sure that this is the perfect option for you. You have elected for the Mirena IUD. The Mirena is good to go for, it looks like, 8 years for contraception, but only 5 if you're using it to manage your bleeding, if you're someone that has super heavy or painful periods. With it being a hormonal IUD, that's also what it's commonly used for, is to help treat those with painful or heavy cycles, because it tends to lighten them up or even take them away completely, which is best case scenario. As far as speaking of bleeding patterns, you may stop getting your periods altogether, which is safe on the Mirena. You may have a lot lighter cycles monthly, or you may have breakthrough bleeding or irregular bleeding that can sometimes last months. So it's hard to know for sure how your body will react. When you get the insertion, it's not uncommon for the first couple months to be a bit irregular, also to get cramping the first week or so after the insertion, but we will want to see you in 6 weeks to make sure the IUD is still in place. That leads me to the risks component of the consent form, that you understand the risks, one of them being uterine perforation, meaning that when they place the IUD, it goes completely through the uterus, which needs to be surgically removed. Happens in about 1 in every 1,000 cases. The second thing that may be a bit more common is what we call self-expulsion, meaning your uterus recognizes that there's some sort of foreign body in there and kind of tries and contracts it out, displaces it, it falls out of you, that sort of thing. And if that ever happens, please let us know, save the IUD, just so we can make sure everything is intact. But if you were to have self-expulsion, it normally happens within the first 6 weeks. That's why we like to see you in 6 weeks, to make sure there's no signs that the IUD is coming out. Does that make sense? Awesome. Of course, with any other procedural risk, you risk infection, bleeding, that sort of thing. Have you looked into all of that and understand it? Okay. Is this your first IUD? Okay. So I'm going to print off that form, and then we are just going to have you sign that before the provider comes in to do the insert. Of course, they will walk you through the entire thing. We really just try to make this experience as quick and easy as possible, of course. And it sounds like you're properly medicated as well, so hopefully this won't be too uncomfortable for you. Yes, so you took the sedative. Before I leave, I'll give you the pain reliever tablets, and then we'll put that lidocaine spray during the procedure. Yes. All right, I just have to take your vital signs if that's okay with you. So let me grab an alcohol swab here, just to clean off my stethoscope. Do you have any questions for me? Good. All right. Clean this off. We'll take your blood pressure, your temperature, then we'll get everything else going. Make sure you put that out. All right, so let me get the blood pressure cup out first. You're just going to slide your arm through there. If you could flatten your feet. Just want to make sure it's nice and snug on you. There you go. Does that feel snug? Awesome. Alright, I'll take a quick listen here. Blood pressure is normal. Let me just squeeze out the rest of that air. Take it off of you. Okay, that should be enough to slide your arm right out. There you go. Right, blood pressure is good. Let's just do that temperature check. This is going to go right underneath the tongue, or what we call a sublingual temperature. Alright, there you go. Perfect. Temperature is normal. Drop the probe. Don't worry, I'm not the one doing your procedure. Okay. Alright, so let me just jot your vitals down there. Everything is normal. No one around you with COVID or flu. Okay, just making sure. That consent form did print, so I'm just going to attach it here to the clipboard for you to sign. There should be a cup of water behind you for the medication, but if you wouldn't mind just signing this consent for me. Thank you. And then we'll make sure to scan it into your chart. All right. So what I'm going to need from you actually is, let me grab it here. I forgot to grab it from the nurse's station. Is you are just going to leave a urine sample. Let me mark your initials here. Okay, you'll just leave a urine sample. We do have to do a pregnancy test before we insert the device. and then you'll leave that urine sample, and then I'm gonna leave you here with 2 pain reliever tablets. You are gonna take that with the water behind you, so I will leave that on the counter for you there. And then when Lena, the PA, comes, she'll do the procedure for you. She will have that numbing spray on hand as well before the tenaculum placement. If that all sounds confusing, she'll walk you through the whole thing, okay? Awesome. Any other questions for me before I leave this room? And oh, other big thing, of course, is after you're done leaving that urine sample, you'll come on in, you'll get undressed waist down, everything top wise can stay on, and there will be a white drape over there for you to cover yourself with, okay? All right, sounds very good. So I'm gonna give you some privacy to get those things done, and then she will be in the next 10-15 minutes. Awesome, awesome. All right, good luck to you. Alrighty, so it looks like we have you on the schedule for your IUD insertion. Your consent form has already been signed off. Looks like you had a consultation. Pretty aware of like the risks and side effects. You want me to go over the side effects not related to bleeding? Absolutely. So it looks like with the type of IUD you chose, which is the Mirena, the hormonal progestin only IUD, because there's a hormonal component to it, you may get some hormonal related side effects. Now, with what I'm about to list, you may get none of these things. You may get only one or a couple, and they can sometimes often be temporary as well. So I always tell people, every individual has such a unique circumstance. Everyone responds very differently. So there's no way to know for sure. I'd like to start off by saying that. But common side effects related to the progestin only IUD is you could get some headaches, you can get mood changes, acne, as well as maybe some weight changes. Okay, I'd say those are like the big 4. Exactly. And I always tell my girls it's good to go for 8 years for the contraception, 5 for the bleeding. But if at any point you are just not doing well on it, I will remove that IUD even if it's tomorrow. Of course, I do like to warn my patients that it's always a good idea to keep it in for like 6 to 9 months if you can, before really judging how it may be long term, because sometimes it can take a little bit for your body to adjust. And for those hormones to adjust, but it's your body at the end of the day. So if you need me to remove it earlier, we can of course always remove it earlier, okay? Awesome. So it looks like you had taken the sedative at home, you were given the pain tablets, and we're going to be putting that lidocaine spray for you. Just confirming, and just to triple check no allergies, right? Awesome. Well, how about we get started on this then? Are you someone that likes when we walk through the whole thing? Do you rather I not really talk so much? You're okay with me walking you through it? Awesome. It's kind of my preference because I feel like that's really the truest form of consent, because you just can't see what's happening on the other side of here. You know what I mean? Yeah. All right, we've got your Mirena IUD right over here. So we'll get this box open up. All right, so first things first, it's gonna kind of be like your routine pelvic exam. If you could scoot a little bit more down. There you go. I am just going to be inserting a speculum here. So you let me know if you get too uncomfortable. You're gonna feel my hands. Lots of pressure here. You're doing great. Cervix is perfectly midline in great position, okay? The next thing is we're going to actually clean off your cervix, but first let's put that lidocaine spray, okay? This is so that you don't feel anything that might be happening to the surface of your cervix. Okay. We'll give that a little bit of time to work. Next, we're going to clean the surface of your cervix with some iodine. Just kind of cleaning everything off there. One more to go. It's kind of like creating a sterile, clean surface where the procedure is taking place, but in this situation it's internal, right? So you can't necessarily see it on the surface. So the next part here is when I'm going to be taking a tool or a sound to measure how big or small your uterus is, just to make sure we can place that IUD, and so I know how far in I need to place the IUD, okay? So this is definitely going to feel like intense cramps because this is a device that's going through your cervical canal up into the uterus till we hit the top of it, okay? Yep. So kind of focus on your breathing for me. You let me know if you need a break or feel like you're going to pass out or anything like that, okay? But hopefully with the pain management things that we've done here, you won't feel as much, okay? Awesome. All right, you just let me know. So I'm going to insert this. All right, coming out. You're at about a 7. Yep, that was it. Oh yeah. You know, and I think it's so interesting because I've seen IUD insertions on teenagers and people in their 30s, 40s, and there's such variability with the response and the amount that they feel, and it's so sad how so many people have been discredited with time because of the people that don't feel pain without any anesthesia or any pain management, whereas someone opposite could feel immense pain. So I'm just glad that they finally taken some change. It only took them like, I don't know, hundreds of years. Anyway, let's see. So we've measured your uterus. So now, let me see here. I am going to be placing a tenaculum. Now, hopefully with that lidocaine, you won't feel this too much. But I'm going to actually ask you to cough, hopefully, so that you don't feel it at all. It's kind of like a bit of a distracted method. But I'm going to ask you to cough, and then I'm just going to hook on the tenaculum, okay? All right. So if you could cough for me. Yep, there you go. It's on. Did you feel that? A little bit of a pinch? Okay, but you're doing okay right now? Good. So let's take out your IUD device. This is the absolute last step here. We're going to place that IUD for you. Let's get everything here. Let's put it, so I'm placing it to the 7 because that's the size of your uterus, okay? This is the last and final part, less than 10 seconds. You may feel those intense cramps. It's going to be pretty similar to when we measured, okay? Because it's the same motion. All right, ready? In at the top, release. All right, it's in. The final thing that I have to do here is just cut the strings for you. Just give me 1 second. How are you doing? Good. Okay, the strings have been cut. Awesome. Let me take off the tenaculum for you. And let me remove the speculum. I want you to just focus on your breathing and relax. I'm going to bring you some snacks as well, since you did just undergo something going into your uterus there. I'm also going to leave you with a little bit of a pad, and then I am going to have you go home with some naproxen just to help with the uterine cramps. I don't want you to get alarmed if you start having some irregular bleeding over the next few months, okay? Yes, absolutely. How are you feeling, by the way? Better than you expected? Awesome. So, of course, as you know, this IUD will be good for 8 years for birth control. But if you're also using it to help manage heavy, painful periods, then about 5 years is when you may want to remove and replace it, if you're interested in that. Yes, yeah, absolutely. But do you have absolutely any other questions? You think you're okay? All right. Well, you did fantastic. I want you to take your time in here. Only sit up when you feel comfortable enough. We'll come back in. I'll have Lee bring you some water and snacks. Otherwise, I would like to see you in 6 weeks for what we call an IUD string check. It's really just to make sure that the length is the same and that everything looks like it's in position and that nothing's falling out. Absolutely. Well, you did amazing. I am going to give you some privacy. Like I said, you take your time, you can get dressed, and then the girls will see you at checkout. Absolutely, not a problem at all. I'll see you later.